Good morning. Thank you for inviting me. I'm just thrilled to be here. And as Dr. Merchan has mentioned, I'm a social worker. I have been a medical social worker for about 20 years, and my passion has become oncology. Right now, I do head and neck, thyroid, and lung cancer, but as you know, the Cancer Club really has very challenging times. So regardless of the type of cancer, we share all these challenges. And I'm here really to talk about the psychosocial challenges that you may face, but most importantly, to give you the tools to try to deal with them, to try to minimize them. So what to expect? So patients, family members, caregivers will experience all these challenges at the physical level, emotional level, and it may happen at different times during diagnosis, right? During treatment, or even after treatment. Now, it's important to know that you will be facing these challenges and that they're not going to disappear. The reality is that they're going to be there, and it's important to understand that we do have a way to create a toolbox that is going to help us deal with them. Now, we have to learn that the idea is to minimize them, as I said earlier, but they will be there. It's just that we have to be a little bit smart and try to keep them under control. Emotional distress. Emotional distress is what we experience when we don't have control over the situation. Emotional distress could cover concerns about relationships and family dynamics. This is important. I like to talk about the family dynamics because many times there's going to be a shift in the role. We may feel like we are the caregiver, and at the time of a diagnosis like this, we're going to be moving into a different role. We're going to be the caregiver. We have to accept the help. So it's important to keep that in mind. Talking to children, whether we're talking about adult children or your grandkids, it is important to talk to them at the level, the age level that they have, because they're little sponges if we're talking about small kids. So it's important to assess what they're thinking about the situation. Many times I have people approaching me and telling me, should I just talk to them about what's happening? And the answer is yes. You just have to be able to use some simple terminology and just answer the questions that they are having. Of course, don't overflow them with things that they are not going to understand, but the key is that you really talk to them. A caregiver fatigue many times is challenging for a patient, but we have to, on the same token, realize that it's hard also for a caregiver. So that's something to keep in mind. Pain and symptoms management. If you are having pain, if you're experiencing pain, the idea is that you come to your team, you let us know. You have your physician, you have the support services. I'm going to talk a little bit more about the support services so you have an idea. But the key is that we're here for you. Financial concerns or insurance coverage issues. These are common problems that you may face at some point. Logistics, something as simple as just going to a medical appointment. You have to have stuff in place. So this could create, again, some emotional distress. What are the emotions that we may be facing at some point? We may go through fear, anger, anxiety. We may feel nervous. We may feel some guilt, some sadness. And the key here is that we know that we may be experiencing then at the same time some physical problems may be present, nausea, pain, again, fatigue, sleep issues, eating issues, and diarrhea. But this is the slide that I want to talk about more, because what's normal? Everybody is expected to have some type of emotional response to this. So what is normal? And the key is that you remember, if it's temporary, it's okay to feel sad. It's okay to have some days where you are feeling tearful, that you're feeling like crying. It is okay to have some level of anxiety. Actually, anxiety is good. It keeps us going, right? Fear. Of course, fear makes you feel uncomfortable because we're out of our comfort zone. So the key again, if this is something temporary that is happening to you once a week, let's say, once every couple of weeks, when you're coming, let's say, to a medical appointment, you're expected to feel some level of anxiety. Now, if you're talking about symptoms that are affecting your day-to-day life, if these are persistent, if they're excessive, then is when we have to start talking about, you know what? This is not good. Because at that time, you may be talking about some adjustment disorder, some major depressive disorder, generalized anxiety, or panic disorder. And these are just really the main ones that sometimes when they're bad enough, you start realizing they're affecting my life, my relationships, at home, at work. So let me just go back. Yeah, there you go. So if it's temporary, this is expected for you to feel like that. Everybody is going through a unique journey towards the cure. So it is important to be aware of this, to become self-aware of that this is something that you at some point may experience. If it's persistent, if it's excessive, if you find yourself having issues falling asleep out at night, or you're waking up in the middle of the night feeling very anxious, very worried, if you start losing weight, not because on purpose you're doing it, but because you're so worried that you're either eating too much or not eating, actually on the contrary, then is when you start realizing something is happening. And sometimes you don't realize that, but then your caregiver, the person that takes care of you, your main support, the people that loves you, people close to you, they start telling you that they notice some changes. So if you don't perceive that, but then you hear someone that really knows you telling you about it, let's pay attention, because it's time to seek professional help. And just going to a little bit of details, because I know my colleague Mary is gonna talk in more depth about the services that we offer. It's okay that if you are having issues dealing with your emotional problems, it's okay to seek help. It's okay to tell your team, I would like, a referral to sit down and talk to someone that is going to help me sort out all these feelings, because at the end, you're not expected to do this alone. And you know what happens with emotions and the feelings? If we suppress them, what's going to happen is going to have some impact in your treatment. You may wake up one day thinking, you know what, I'm just too fatigued, I'm not going to go today. You're expected to feel fatigued, but then, the way of thinking, I'm just going to stay home. That's not good. So what I want you to remember here is that it's important to recognize these symptoms, because if you're going through the journey of cancer, okay, and working towards your treatment and following all the advices that your medical team is offering to you, it's important for you also to do your part, okay? Adjusting to living with cancer. Well, nobody's prepared for this. As I mentioned earlier, this is a tough club, okay? Nobody wants to be part of it, but now that you're not alone. You have your team. It is different for everybody, and that's important to be mindful about. I cannot compare, despite the fact, for example, we have been talking about kidney cancer. You cannot compare your journey to the person next to you, because you are unique and you're really the one that knows what works for you and when something is happening to you. So you are, in other words, the expert in your life. Me as a social worker, as a clinical social worker, I'm here to make you aware of what's happening, but then also my role is to listen to you because you're the one who knows yourself better. There's some factors that, of course, they could affect how you adjust to living with cancer, and sometimes these factors could be having or not having some family support, people that is able to sit down and listen to you, if you're working or not, if you're retired or not. So again, this is general information that you can tailor to your own experience. Ways to cope, and I like this because it's kind of catchy. ACPA. So ACPA is ask, get, pay attention, and allow. And ask for what? Ask for support. Ask for support from your family. Ask for support from your friends, the people that is close to you. Believe me, just talking about it when you need to, having someone there is going to make a difference. We have at Support Services, spiritual counselor that is wonderful. This is just for you to know that the resources are there if you need them. Get the support. So the second step is not only asking for the help, but really getting the help. We have, as I mentioned, social workers. Here we have psychologists, and we are mental health professionals that we're trained to counsel you. Again, you're the expert, but we're able to help you with the tools that you need to feel better. Maybe a support group is what works for you. And I hear this, it resonates. So after, maybe during lunchtime or after the symposium, maybe we're able just to sit down and I can gather the thoughts that you have, because if that's something that works for you, let's work together to make it a reality. If, for example, talking is not something that comes easy to you, explore your feelings, don't suppress them. Try to do some journal, try to understand how you're feeling, and you can find that that it may illuminate you. Pay attention. Now, paying attention is easy to say, but it's not. Because you are going to have physical needs, you're going to have emotional needs. It's very important to rest. Nutrition is another key factor. And but what better way to start with nutrition? And you're going to talk to Leslie later. But these are simple things. What I'm telling you about are simple things that sometimes we are so wrapped up in the treatment process that we forget about how we feel. And that's my goal here, so you can understand that how you feel is going to impact your treatment. Now, allow yourself time just to relax. Incorporate some downtime into your routine, your daily routine. It is really important. Oops, we're having some accidents here. The microphone. I'm sorry. Okay. There. So, allow yourself that downtime, because you have to be able to find time to incorporate that relaxation into your daily routine. Don't think about, I'll just do it on the weekend. No, it is important every day to keep it in mind. Even if you're taking time, just 5 minutes to relax, to go in your mind through what happened that day, that's the key. If you want to help yourself, you have to incorporate that relaxation time into your daily routine. Now, tips for patients. It is important for you to be informed. It is important to communicate with your medical team, with your support services team, because sometimes, let's say you may have some questions as far as the treatment that the doctor is just recommending, but you just feel fearful as far as, is my insurance going to cover this? So it is important for you to be informed. It is important not to be afraid to ask. It's important to reach out to your insurance and ask them, I wonder if, this and this and this is covered. It's part of my policy. This and this medication, am I going to have a high co-payment? So these are things to, to think about. And these are part of your rights and responsibilities as a patient. You have to be informed. You have to be able to communicate. Now, I keep repeating, you don't have to do these alone. So it is important to seek professional help when you encounter the difficulties. It is important that if you're coming to an appointment Usually we remember what we want to ask about at home, so write it down. So by the time that you come to your appointment, you know what to ask, okay? And this not only applies to medication, but again, the day-to-day things that are happening to us, transportation, something as simple as I mentioned, logistics of going to the appointment, having someone available, okay? If that's a concern for you, write it down so you don't forget. You have to be open. You need to be open to new ideas. You need to be open to new treatments. If the one that you're using, the doctor is telling you that it's time for you to try something different. And you have to be open to try and try again. Because believe me, it's not easy. And this takes us to expect to be afraid. Because who's not afraid when you have to try something new? So it is important to expect to be afraid. It is important that you know that the fear is going to be there. I'm going to borrow this story from a colleague. And basically, what do you have at home? You have different rooms. You have your bedrooms, you have your living room, you have your dining room, you have your patio, right? But let's say that fear is roaming throughout your house. You're going to feel extremely anxious. Nobody can function like that. But what if we try to learn a way to minimize the fear? Let's have the fear in just one of the rooms. You're going to function better, right? Now, it's not going to go away. I'm not going to tell you because fear will always be present. And one of the biggest ones is really fear of recurrence. Let's say you finish your treatment. The fear is going to be there, but we have to learn ways to manage it. Okay? It's never going to disappear, but if you keep it under control, if it's, let's say, I'm going to keep it just in one of the bedrooms, that's going to help you a lot. Some relaxation techniques that you may have heard of that may be beneficial are deep breathing exercises. In this type of exercises, you learn how your breathing pattern helps you relax. Progressive muscle relaxation techniques are the ones that usually entitle your whole body, and you're going to be contracting your muscles one by one and then relaxing them, and you're going to be more aware of your body with the goal of achieving some relaxation. Meditation, self-guided imagery, and yoga. Again, these are tools that you can use. You don't have to use all of them, but if you think that they might be helpful, why not? Just give them a try. If you have never done it, you have, again, social workers, psychologists, have support services here for you. So we can work with you. We can walk your own pace. Just ask. We're here for you. Keep in mind that you may already know what works for you. Again, something as simple as if you know that relaxing music, calming music works for you, use it. Again, just incorporate into your daily routine. Little things that sometimes we overlook, that they can have a huge impact in your quality of life. Set goals. Short-term and long-term. But the most important thing is that you have to make sure that they are realistic and they are achievable, because you want to give yourself positive reinforcement. Who wants to set a goal that, if you're not going to achieve, how are you going to feel? Frustrated. So make sure, just going back again to the transportation example, if that's a challenge for you, let's make a point that I'm on time for my appointments. And you're doing it today. At the end of the day, you're going to feel accomplished. So try to keep that in mind. Set your goals long-term, short-term, but make sure that it's something that you can accomplish, because it's going to make you feel better. Tips for the caregivers. Self-care. It is important now, on the same token, to be aware of your physical health, emotional health, spiritual health, and also get the help when you need it. Now, the caregiver's role is very challenging because they want to be able to cover all the bases, to be there for you, to do everything, and that's exhausting. So, first of all, you as a caregiver, you're not going to be able to do everything. And that's a reality. You have to learn to delegate. You have to help the patient by helping yourself first. Take time also for yourself to try to relax, to gather your thoughts, and that's the best way for you to be supportive. If you recharge your batteries, you're there when they need you. Know and accept your role. So it's easy to say, I know what to do, but now accept it is a different story. For the caregivers, it's challenging. And I like to remind them, remember, you're there for them, you're there to help them, but you're not the team captain. You're not there leading the team. You are part of the team. And sometimes that's painful, because you have to be able to understand as a caregiver that is not your journey, that you may not agree with the decisions that the patient is making. But we have to be able to accept that they have the freedom to make decisions based on their belief. They may have some wishes that they don't agree. They're not, similar to what we think that it would be the best course of action. But that's the reality. So again, we have to accept that role. It's their journey, and we are there, to support them. Additional resources. There's many organizations, and they can cover from practical stuff, such as, if you have high co-payments, services not covered by your insurance, even emotional support. But it's important that we actually look for them, because again, the resources are there, but if we don't seek the help, we're not going to know. And if we don't know, we're not going to be able to make informed decisions, right? So it's important that even if you don't know where to go, you ask your team. It's important that at the time of your appointment, remember, if you write it down, you come to your team already with the questions, okay? So if you have a concern, write it down, bring it to the team, and Dr. Marchand talked about many medications. Again, going back to just a simple concern, high copayment. Sometimes that happens. Sometimes the insurance doesn't cover, let's say, the third line therapy. It has happened to me with patients that insurances have some criteria. They want you to try this, and then they cover something else. So it may be overwhelming. Emotionally speaking, that's overwhelming. And your role as a patient, for example, is to take care of yourself. As a caregiver, to offer the support and to be there. So we're here to facilitate this process, to make sure that we help you navigate the system, to give you some level of relaxation where you're able to focus your mind on your care or your loved one. Does it make sense? Okay. Now, this is something that is important for you to know. Technology is on your side. There's many applications. Remember about the tools that we talked about? The goal is for you to achieve some relaxation. So there's some applications right now for people, if many people nowadays have a smartphone. So you're able to download these applications. They may be free, some they are not, so it's important to check. But they give you, for example, Insight Timers is one of my favorites. Someone, for example, may prefer a nature sound. It's just really calming sounds. But just give it a try. If this is something that you think that might be helpful, that is a good tool for you, just give it a try.
What's Insight Timer?
Well, it's like, when you do meditation, it already has messages, like pre-recorded. So instead of having, let's say, a professional next to you doing deep muscle relaxation, you're actually listening to the person right there. And you can actually time it to, let's say, 5 minutes, 10 minutes. So it gives you some freedom. A word of caution, to Google or not to Google. And this is important because this is something that we do every day. Every day we Google something, right? Now, it's important that you look for ways to cope with the challenges that you're facing. If this has been something successful for you in the past, it is okay to Google if you're trying to find a group. Again, here we go again, sorry. There you go. It's important that if you are thinking about the support group, you're able to go ahead and Google about them, ways to self-help you, and if you're concerned about the financial resources, you can certainly Google that. In other words, if your medical team approves, go for it. But if you're experiencing some symptoms, something is bothering you, and then let me Google here, the reason why, Google about cancer, alternative treatments, my suggestion is don't do it. Don't do it, because the whole goal of this presentation is to reduce your anxiety, reduce your worries, and your medical team is the most familiar with what's happening to you. And remember what I said, every person's case is unique. Every journey is unique. Well, keep that in mind, because if you start Googling all this stuff, instead of trying to relax, you're gonna feel more anxious, you're gonna feel really depressed, and you are gonna end up going or seeking services, at the counseling level with either psychiatry, psychology, social work, because you're very anxious. So please stay away from Googling all this stuff that you may think that it's helpful, but in reality it's gonna create more anxiety. So in conclusion, what do you have in your toolbox? Remember, you have your medical team, you have your doctor, you have your nurses, the nurse practitioners, support services, social work, psychology, psychiatry, acupuncture, music therapy, exercise physiology, nutrition, and many more. Your support system, of course, if it's your family, people close to you, that's who you need to stick to. It may be tempting to try to deal with this alone, but the key is that you have to rely on them. Of course, your knowledge. The more you know, the better decisions, the better informed decisions you're gonna be able to make. And you're gonna feel less anxious, because you're gonna encounter yourself making decisions based on what you have learned. It's hard when you make decisions without the proper knowledge. Your coping skills, remember, and your preferences. So this is what you have in your toolbox, and learn to use it. We are here for you if you need us. Thank you.